Hello everyone, it's Schematic Med, and today we're going to talk about the management of carotid arteriosclerotic disease. First, everything starts with intensive medical therapy, which includes aspirin, statin, and blood pressure control for all patients. Then, we need to evaluate to understand if we need and can do carotid revascularization. The question that we need to ask is, does our patient have any symptoms? If our patient does not have any symptoms, the management is different. When we ask a question, do you have any symptoms, and the patient says no, we need to assess the degree of stenosis. If the degree of stenosis is less than 50%, you can see here I try to depict the vessel, and you can see that the occlusion, which is the dark blue side, is less than 50% of the vessel. So this time, there is no benefit from CEA. Once again, when we have an asymptomatic patient and the degree is less than 50%, there is no benefit from CEA or carotid endarterectomy. We will recommend intensive medical therapy with periodic carotid ultrasound. Next, when we have occlusion from 50 to 79%, you can see it's already occluding half the vessel, and we see the smiley face here, which means there are no symptoms. In this case, CEA typically is not recommended, but may be recommended in select patients with low preoperative risks. For example, when preoperative risks are less than 2% or 3%. Next, we can have the occlusion from 80 to 99%. You can see there is only 1% that is not occluded. Here, CEA is obviously recommended. Now let's start to understand what we will do if we have symptoms. It is logical that when we have symptoms, we need to do intervention when we have a lesser percentage of occlusion, right? For the first case, it's the same. When it is less than 50% occlusion, there is no benefit in doing CEA. It doesn't matter if the patient has symptoms or not. Next, here is where the main difference is. When we have occlusion from 50% to 69%, you can see the face is set, meaning it has symptoms. And here it is not 79%. The percentage is decreased to 69%. CEA is recommended only in several cases. Males are more likely to benefit from CEA, and women are more likely to benefit from intensive medical therapy. Next, when the occlusion is 70% to 99%, it is obvious that the threshold percentage is decreased. It is 70%, not 80%. Here, CEA is obviously recommended. And one thing that I want to mention is that not only medical and surgical therapies should be discussed with the patient, but the patient should also be counseled on lifestyle changes to reduce future stroke risk. Thank you, bye.